Thanks for watching TMA's Legislative News Hotline for Friday, March 31st. I'm Brent Anier.
Representative Longoria now moves that SB1 as substituted be reported favorably to the full House. Clerk will call the roll.
That's House Appropriations Committee Chair Dr. Representative John Zerwas actually calling the vote on his committee's budget bill, House Bill 1, on Wednesday. It's the formal procedure for the House budget writers to pass their budget proposal this session. The committee unanimously approved the bill. TMA is still studying it and comparing it to Senate Bill 1, which the full Senate passed on Tuesday. But here's what we do know. The House budget is a $218.2 billion all-funds budget. That includes federal money. The Senate's proposal is $217.7 billion in all-funds revenue. In state general revenue only, the House bill spends $106.7 billion, while Senate Bill 1 would allot $106.3 billion. Early news reports say the House plan would cut $1 billion in state general revenue funding from Medicaid by pursuing greater program flexibility from the federal government, though it's unclear at this time where the cuts would fall. There are another $560 million in general revenue cost containment cuts to Medicaid and Health and Human Services. The savings will come from contracting and other policy changes, though the details are unclear as to how or whether the cuts would impact patient care or payments. We will keep you informed. The full House could consider the House budget bill late next week. Progress on a bill to regulate the practice of telemedicine in Texas. Wednesday, the Texas Senate unanimously approved the bill, Senate Bill 1107 by Senator Dr. Charles Schwertner. He says the measure creates a framework for telemedicine care in Texas, establishing a clear definition of telemedicine in state law and clarifying that the same standard of care that applies in traditional in-person setting also applies to telemedical services. Earlier in the week, 2 TMA physicians testified before the House Public Health Committee in support of the Senate bill's House companion, House Bill 2697, by Representative Floor Price. They praised the standard of care provision and the fact that physicians should be paid accordingly for delivering care via telemedicine.
Telemedicine is in fact medical care. It is not something peripheral to or distinct from conventional care, and in doing so, we then create the regulatory expectation that we meet all the standards and guidelines associated with routine medical care would also apply to telehealth care.
I'm in support of this bill because I believe that it clarifies a lot of the opaque areas of telemedicine practice in Texas. There have been a number of different debates about what was appropriate telemedicine care, and we think this takes a big step in the right direction.
Telemedicine is a TMA priority this session. Both the House and Senate bill are the result of months of negotiations by TMA, the Texas Academy of Family Physicians, and the Texas eHealth Alliance, which is a group that represents several telehealth companies. Tuesday, 2 physicians testified against a bill that could raise medical liability caps on non-economic damages. You may recall in 2003, Texas passed medical liability reform, setting these caps at $250,000 for all physicians in a liability case. The House Judiciary and Civil Jurisprudence Committee heard House Bill 719 by Representative Gene Wu of Houston, which would index the caps to inflation. TMA strongly opposes this bill because premiums would likely increase, eroding patients' access to care. A Fredericksburg family physician told members medical liability premiums forced him out of practicing obstetrics before 2003. Then his practice placed this newspaper ad after reform passed, announcing they could once again afford to deliver babies. They've done so ever since.
So now I hear that this new House bill will be passed that's going to increase the caps, which I'm assuming would increase the premiums. And once again, we're kind of put in that situation of, can I make my overhead? Can I continue practicing what I do?
My oldest partner is 58. He told me if tort reform changes and we go back closer to what we were in 2003, it's an easy decision. He's going to retire. That's going to leave 2 of us. I've been trying to recruit a replacement physician for 2 years. Thus far, we've been unable to. When you look at your overhead, and malpractice insurance is certainly one of those things. At the time when we decided to stop doing obstetric services, that was probably the biggest expense in our practice.
That last gentleman was a North Texas family physician who also described the challenges posed to small-town do-it-all medicine if the caps were raised. A TAPA, or Texas Alliance for Patient Access attorney, also testified about the loss of physicians and medical liability carriers in Texas before reform, and how reform brought more doctors to practice here since. The bill was left pending. A bill to raise the legal age to buy and use tobacco is back in the news this week. The House Public Health Committee heard testimony on it on Tuesday. Representative Zerwas introduced his bill, House Bill 1908, which would raise that legal age from 18 to 21. More than 13,000 Texas kids become new daily smokers every year, and nearly 500,000 young Texans will die early from a tobacco-related disease unless they reduce tobacco use. And close to 95% of smokers take up the habit before age 21. Houston neonatologist Dr. Charlita Guillory supports the bill. She says raising the legal age will, among other things, reduce the effects of secondhand smoke on infants and children.
My primary care colleagues will tell you children and infants are often hospitalized longer for asthma and respiratory infections when compared to children who are not exposed to tobacco. This is why they counsel teen and their parents in a well-child visit to avoid tobacco use at all costs.
The bill is a TMA, Texas Public Health Coalition, and Texas 21 Coalition priority. After hours of testimony, the committee left the bill pending. Byzantine, rigid, exasperating, and mind-boggling. That's how one doctor said people characterize the Medicaid vendor drug program in testimony on Wednesday.
Good morning, Chairman Schwartner.
Dr. Ryan Van Ramshorst, the chair of TMA's Committee on Medicaid, CHIP, and the Uninsured, urged the Senate Health and Human Services Committee to pass Senate Bill 1922 to revamp the program. Senator Schwartner is the bill's author. Dr. Van Ramshorst told the committee that Medicaid patients can be jeopardized when prescriptions are delayed by the drug program and the confusing preferred drug list. He said those delays preventing patients from getting necessary medications can harm them or add costs or both. He asked senators to consider the bill's protections.
Some of those protections include limiting step therapy, which means that as a physician, if I wanted to prescribe a certain medication, you have to perceive up a protocol to get to the top class of medication, and making sure that you don't have to do that over and over again for the same diagnosis. One of the other things that it calls for is what's known as a continuity of care provision. So if a patient switches from one Medicaid managed care organization to another, I have 90 days to change the medication if I need to because the formulary is different or is changed.
The House is considering keeping the vendor drug program under the authority of the Health and Human Services Commission, while the Senate is considering carving it into the Medicaid managed care organization. The Senate Health and Human Services Committee is also considering a bill to update the nutrition, physical activity, and screen time standards for child care facilities. San Antonio pediatrician Dr. Julie LaBarba says she supports Senate Bill 818 by Senator Kirk Watson of Austin. The bill sets clear guidelines for healthy meals at daycare facilities and new standards for time set aside for physical activity. It also reduces the amount of time children would be allowed to play on electronic devices like computers, tablets, or smartphones while in daycare.
Between 0 and 5 years of age, this is a critical period in child development in terms of health and wellness. And we know that if we can develop tastes and preferences and habits at this time, it really can lead to a lifelong wellness path.
Dr. LaBarba told the committee that 31 other states have already adopted similar guidelines to help children build healthy habits. She testified on behalf of the Texas Pediatric Society and TMA. The bill is pending. Will you be in Austin on Tuesday? This coming Tuesday, April 4th, is the third TMA's First Tuesdays at the Capitol event this year. Join physicians, medical students, and TMA Alliance members in Austin. There will be plenty to discuss with your lawmakers as bill activity heats up. That's it for this week. I'm TMA's Brent Anir. Thank you for watching, and please join us again next week for TMA's Legislative News Hotline.